Welcome to the students of Saybrook University. I'm Norman Doidge. I'm the author of The Brain That Changes Itself, and I'm on faculty at the Department of Psychiatry at the University of Toronto and Columbia University Center for Psychoanalytic Training and Research and the Toronto Institute of Psychoanalysis.
Sir, can you just tell us how you first became interested in the field of hypnosis?
Well, it's hard not to be interested in hypnosis, especially when you're young, and I was interested in it when I was young. Just the very unique things it seemed to be able to do. And then I went through a period where I was somewhat wary of hypnosis, in part because of the model of the brain I had, which was one that really focused on the fact that if people had been traumatized, it seemed to me that they'd laid down a kind of circuitry that you wouldn't want to go around. You'd want to go through, if you will. And so the idea of some of the hypnotic practices that people would have, of trying to make people feel very safe and comfortable and then reframe the traumas and use suggestibility to do that, I found kind of disturbing, because I thought it would just mean that the traumas would be buried deeper, if you will. But as I started to learn more about the brain, I started to realize that, a number of things. One of the things is, of course, that the virtual reality kind of experience that you can create in hypnosis is a very real thing. So you can get a person to imagine certain things, and the way that the brain is set up, you really can sort of change brain wiring by doing that. I didn't really appreciate that. I, like most people at that time, was very much of a dualist and sort of thought that you have mind over here and you have brain over here, and they function by different laws. I mean, that was the general teaching. So anyone who argued that the mind could restructure the brain in some ways was making a sort of incoherent claim, because if they worked by different laws, then where would be the intervention point where one could change the other? But as I started to learn more and more about therapy and many different kinds of therapies, and learn about plasticity, I realized that mind is restructuring the brain, so that the claims of hypnosis really weren't as far-fetched as I feared. And I also began to understand that if you look at me now and then close your eyes and imagine me, it's virtually the same coalition of neurons that are firing at the same time, that are firing in both situations. And so really what that means is that it really is possible to kind of create a new kind of reality experience with the imagination, and that's happening all the time. So that lent a real credibility to certain kinds of hypnotic claims, that you might actually be able to go into a lot of these traumatic or difficult situations or anxiety situations or painful thoughts and alter them with hypnosis. And that came directly out of my interest in plasticity, really, and my understanding as to how the brain was structured. And the more time I spent looking at hypnosis, the more I realized that the very real extent to which so many of the new therapies that are coming along really draw upon hypnosis, or drew upon hypnosis in one way or another. Hypnosis has just been such a fruitful activity for psychotherapy. So that's one thing. And I also started to realize that the usual narrative that's given about the relationship between modern psychotherapy and hypnosis isn't quite accurate. The usual narrative is that Freud was a very serious hypnotist at one point, and then because of a variety of reasons, one of which was he thought he wasn't a great hypnotist, and he'd known many great hypnotists, so this wasn't false modesty. He turned his back on hypnosis, and he also felt that not everyone was hypnotizable, and there's some variation there, of course. And he also became quite wary of the role of suggestion. But there are deep hypnotic. Psychoanalysis has deep hypnotic roots, and from the couch to the role of free association, and it became clear to me over time that the best psychoanalytic sessions involve the patient often being in a mild trance. The idea was, no, they would be using their reason and their ego to sort of get in touch with things. But, I've now practiced psychoanalysis for decades, and I'm quite aware that when patients are free associating at their best, they're very much in a light trance, and that the analyst, too, often enters a light trance. And Freud was very mindful of this. I mean, when he would talk about the analyst having free-floating attention, I think that that's a trance-like state, and that the idea was that you don't enter the sessions with an agenda so that presumably things can flow up from your unconscious mind. So, I mean, I think any serious psychotherapist who's, I can't say this goes for behaviorism, I can't say this goes for CBT as it's been standardly practiced, but any experiential therapists, psychodynamic therapists, are deeply indebted to these incredible breakthroughs of the early hypnotists. And so much of modern psychotherapy grows out of those early periods, and Genet and so on and so forth, that I just think it really behooves us to, at the very least, understand the accomplishments of the hypnotist if we want to understand modern psychotherapy.